Good afternoon, everybody, and thanks for staying until the very last talk. I'm going to talk a slightly different angle of the impact of the disease. And this is some work that we've done between PBRITE and the veterinary services in Mongolia. Okay, so just to give you a bit of background, Mongolia is a very large landlocked country in Central Asia, and it has one of the highest per capita livestock ratio. Just to give you an idea, it has around 3 million people, but 30 million sheep, and 27 million goats, so you can have an idea of the ratio there. The livestock is mainly kept by nomadic herders, which are transhumans, and livestock really is their main source of food and income. Okay, so as you can see from the graph below, since 2017, the reported outbreaks to OAE really increased compared with previous years. They affected, 8 provinces, all of them in the east part of the country. And the current control measures include vaccination, modified stamping out when they only call the animals with clinical signs, and movement controls. Okay, so what we aim in this study was at 2 levels. So the first one was to assess the socio-economic impact of foot-and-mouth disease, but not just the disease, but also the control measures that are put in place on the herder, and to assess the effect that it has in their food availability and access. So these 2 are at herder level, and the last aim was to estimate the national gross and economic losses at country level. And we did that during the outbreaks that were only in 2017. So the approach was a retrospective study. For the first part, we conducted herder interviews that were affected, as I say, between January and December 2017. In order to select the herders, we used the official list that the veterinary services keep. And what we did is we selected 10 herders in each province that was affected, 10 herders that were affected per province, and then also, by affected, that means that they have clinical signs, animals with clinical signs, but also 5 herders that were not affected by FMD in each province, but they were within the quarantine zone, so within the movement control. Okay. Just to mention here, in each of them, we have a standardized questionnaire, which we developed with the team from Mongolia with a lot of discussion. We piloted first in 3 herders, went back, discussed a lot of the question, and we ended up with quite short questionnaire to evaluate the impact on them. Okay, so what we had here, we interviewed 112 herders, 70 of them were affected, and 42 were in the quarantine zone, but without animals with clinical signs. Not surprisingly, most of them were nomadic herders, and only 13% of them were in a fixed location. All of them in one province, which is quite an industrial province, so the production system there is slightly different. Just to give you an idea of the size of the herd, and the difference between the 2 herders affected and not. In the case of cattle, we have the median was around 15 animals, but with the important difference across the different provinces. In case of sheep, the median is between 180 and 700 animals, depending on the province that you look at, and goat similar, between 120, 500 animals, with some of them having much larger herders. Okay, when we look at the results, so how the control measures affect different herders. So half of them, from those that have clinical signs, or around half of them, affected plans to sell animals. That means animals that they had planned they would sell, they couldn't sell it because they were called during the control measure. And it was a similar proportion in the ones that were just in the quarantine zone. This is quite a, well, probably not that surprising in the ones that were affected. They were, most of them, so around 8 out of every 10 herders that we interview did not drink milk for a period of time because of the control measure. So it's similar. It's milk that they have thought that they had available during the next month, they hadn't available anymore. What is quite surprising and something that is not looked at very often is that the ones that didn't have animals with clinical signs but were within the control zone were equally affected in terms of milk consumption. Now, a bit less of them drink less milk during a period of time, and similar picture for the ones that did not eat any meat, the same as meat that they were planning to eat. Here we've observed kind of a seasonality effect that we're exploring now in more detail, but it seems like these herders that are affected before, during or after winter are a bit more prepared because they already have dry meat that they prepare for the winter. So if the outbreak comes during this time, they get a little bit less affected in that sense, in meat consumption. Whether if it happened just before winter, when they have no preparation, nothing in a storage, then they get even more affected, and also the effect lasts longer. Then some of the coping strategies, like they have obviously if there's available, they purchase meat or milk. In other effects were things like not able to buy medicines or send kids to school. This is the only one that was a significant difference between the ones that were affected or not. The other ones, the effect is very similar. Kids sent to school is affected in different ways. Some more in the social side is that they cannot receive visitors or they cannot go out and visit people. Now, some of the coping strategies is borrow money for a range of things, including buying food or animals or medicines, or inclusive having to borrow more money to pay bank loans, so they get even in more debt. Okay, and this is just to illustrate, although it was a very quantitative questionnaire, we left at the end some space for comments, and that is just some of the comments that some of the herders say how hard it was during the control measures. Right, and now just here, just to illustrate how long the effect lasts. So, for example, in days without drinking milk, it goes in some of them up to 3 months. And in the ones that had clinical signs, up to 4 months in some cases, which means that it's much longer than the time that the control measure lasts. So it's once the movement control finish, the effects last even longer. Okay, and this is just see if they have been able to buy animals to replace them. Most of them haven't. There is a compensation program which takes quite long. When we went to interview the farmers, they haven't received the compensation, which was months later. So, and herders obviously are not very happy about it. And we're talking a lot in previous talks about encourage farmers to report, to send samples, and this is probably something that disencouraged them. So it will be probably a point that it can be improved. Okay, and just for the national level, quick, we did the gross losses, so we didn't look at all of them. So what we did is mainly reaction expenditure, and that's data that was collected by the vet services in the regular basis. So how much they spend in the vaccination, in delivery, in sampling, in testing all the samples. From the direct one, we only have the losses in culling and animals that die. And the overall losses were around $7.5 million, which change slightly in the different provinces depending on number of animals affected, and some of the control measures change slightly in some of them. So that's where the differences come across them. Well, one important thing here, we are only estimating the cost, but we haven't estimated the potential benefits and how this control will impact over time. So we don't know if it's in a cost-benefit analysis will give us this answer. We only have part of the picture here, so just the cost, but not the next part, which is something that probably can be done in the future. Okay, so just the main remarks. I think this is one of the, at least in Mongolia, is the first assessment on the impact of no FMD, but the control measures, which I think a lot of time is not looked at, but is necessary if we want to go from endemic area to control it. All the control measures in the middle, farmers get an impact, but it's things that can put in place to make it easy for everybody. For example, if we know that if the outbreak happened before winter, they get more affected, probably some measures to help them with food or things like that can help them on the impact, but also to keep them engaged with the program. We also quantify part of the food security, including access, availability, and seasonality. We didn't explore how the food is distributed within the families, so it's probably some of them get more affected than others. We don't know. And we also quantify the national expenditure. We believe that even though it's focused in Mongolia, it gives a picture of what it can happen in some of the countries going towards control. Okay, and just to acknowledge all the agencies in Mongolia that provide with all the data. What it was before, the Veterinary Animal and Breeding Association funded part of the field work from field vets going out and interviewing farmers, and also obviously all the field vets and the herders that were willing to take part and share their information and experience. Okay, and that's it.